There is a patient who came in with horrible ankle arthritis, and he was in his mid-60s, and he said, I can sort of get by on this. My pain is manageable, but I am in daily pain. And at the end of the day, he felt like he was in good health, and this is a great time to undergo surgery. So we went for it, and he is just so happy that he did that, because now he walks for 6-7 miles, he goes hiking, he does all these things, and I'm just glad that he had a great outcome and that he's really happy. Data shows us that you're gonna do better with the surgeon who does that procedure all the time. I think it's completely fair when patients ask me if I'm gonna replace their ankle, how many of these have you done? It's a question that I would ask if I were a patient. And luckily, I have enough experience and confidence to give them the answer that they want to hear. That's a privilege.